Alex, welcome. Thanks so much for being here. One of our greatest innovation champions in the room, together with two more innovation champions from Egypt. Next time you're in New York, we are very curious to hear the Egypt journey. Today, we're hearing about Moldova. And I won't preempt too much, but Alex, it's a big, big pleasure. Moldova is one of the outstanding star offices that we have. You are one of the people who really pushed the envelope on so many different fronts, setting up the lab, first randomized control trial in UNDP, pushing the envelope for behavioral insights, amazing blogger. But the rest, I'll just hand over to you. Everyone here in the room, I think, knows each other. It's our small group, as said, but we'll record it and share the recording widely. Thanks so much for being here, Alex.
Thanks very much, Ben. You set the bar very high, so now I really will strive not to disappoint with what I will be saying. Thanks also for the title for the presentation about innovation with human face. It's not necessarily my face, it's just the way how we are engaging with our clients and with our partners, showing that actually innovation is not just a change in a business process, but it's a change of nature, how we work with the outside world. And as Ben mentioned, Moldova really was a sort of early starter in innovation, and we really tried to test and get our hands dirty with different type of things. We had a gaming platform, we started randomized control trials, we had hackathons, public challenges, so we wanted to get a taste of everything. And of course, initially it was more about internal discussion in UNDP, how we improve efficiency, how we make what we do look cooler and more interesting for the outside audience, how we use innovation for rebranding UNDP in many country offices where we try to support people and the governments. But what we came quickly to realize that it's actually not that much about, not only about how we change from inside, how UNDP works, but it actually can be also, let's say, a new service line, a new type of support that we can provide to the governments with whom we are working, and in a way trying to change even the dialogue between the state and the citizens in respective countries where we see the context fit. So this is how we started more than 1 year ago, our work with the lab. We set up a lab inside of the government. It's clearly not sort of at the center of the government. It's not yet something that influences thinking and vision of the government. But at the same time, we are working on building, in a way, our case, building our portfolio, evidence of how the work that we are doing with the partners in the government can change the conversation, can change the tone of conversation, and actually make the government more efficient and more trustful partner for the citizens. Here is in a way our the logic, in a way, of why we decided to set up a lab, let's say, from external motivation. What we clearly see, the trust of people in public institutions is very low in Moldova. It was going down and down, and while of course we cannot at the level of the country office change the things at the macro level, what we can do is try and drive the change at the micro level, and looking at the particular, for instance, services, look how we can engage both government officials and the people, users of the services, to have the services better by including inputs from public officials and from the people, and make those services relevant and responding to the expectations of the citizens, but at the same time being understandable and bring satisfaction for the servants who are delivering. Another one is important sort of a add-on effect is that once representatives of the states and people are engaging in a joint activity, the dynamics around the trust between them changes. Because after all, we can talk a lot about politics, about political parties and these kind of things. After all, the immediate interface between the state and the citizens are the services. So if we change the dynamic around the services, we changed a variable in an equation in the relationship between citizens and the trust, and we could start building a new kind of relationship. And I will bring a couple of examples of this work later. And then what we thought is important that government is not a reactive player, but is proactive player. And this is something that relates to our future product line in the lab. I will be referring later. We think that the government should have a much stronger anticipation capacity. I'm talking specifically about Moldovan government, but of course this relates to many governments around the world. In Moldova last year, we had a sort of a perfect storm where we had banking crisis, we had geopolitical crisis around Ukraine, we had a resulting recession of Russian economy, and Moldovan economy depends a lot on Russian economy through remittances and exports. We also had a drought beyond this. So it was such an amalgamation of factors that clearly government needs to see what can be done in these cases, anticipate this, but at the same time, it needs to have a capacity of what we call the horizon scanning, to understanding with similar challenges, what other governments are doing. What of this experience would be applicable to Moldovan context, and whether the lab would be able to help the government to test those approaches and mainstream those. So this was the main logic around this, and of course there is a sort of a global dimension to this. We all know that the sort of a nature of the government has been changing quite significantly. The advent of technologies made the service delivery completely different, and expectations of citizens towards state delivery of the services different. People expect much more services being, for instance, available at their desktops or their smartphones. And in Moldova, there was some progress, like with online tax paying and using of mobile signature and so forth. So we thought this kind of trend will only magnify, and state has to be able to deliver to those expectations. Another important thing, it's clear that states, even in the most developed countries, with a lot of resources, are not able to respond to all the demands that are coming from the citizenry. Even more so in Moldova, where a state is very much deprived of financial resources, and where the state of the human resources in the government is also deserves something better. It's clearly we need to involve society in finding solutions, in discussing what are the possible solutions, even maybe developing certain solutions. And for instance, in what happens with the open data initiatives in Moldova, we see that there are a lot of initiatives where citizens by themselves developing software to use open data that the government puts online, and tailoring those so that ordinary people can use them. And another important factor is that the decisions, how the decisions are being made, it's often not only that the government can take a decision and everyone will follow it. It means that the decision should be more and more be taken in a broader setting, where different players in society, not only the governmental, should take part in this. And we thought that the lab would be a proper player, of course, not to ensure this, but rather to test different approaches for this, showcase it, and help the government follow the suit more. Before I would be going to describe more that what the services lab is trying to offer, I think it's very important to also to see the context. And while I have talked about macro things, I think there were key ingredients for this work happening also at the level of, for instance, of personality, specific issues in policy context. And for instance, what we clearly learned in the process, and how we started, it was only possible to start because we had very dedicated champions inside of the government. One of the initiatives was the e-government center, which is placed in the state with the state chancellery of the government of Moldova. It's at the center of the government. They're responsible for a digital by default agenda and by promoting interoperability platforms, mobile signature, and other things. And their realization was it doesn't make sense to simply digitize services before you actually rethought them and tailor them to respond better to citizens. But the strength here of UNDP was that we already were in discussion, for instance, with the MiLab, with FutureGov, with other partners outside who are applying design thinking to redesign of public services. And this is, by the way, was one of the strengths that in Moldova, it's only UNDP who really knows it. It's where us who were pioneering with the redesign of police station. And this is where we were the most evident partner for this initiative from inside of the government to offer support and also to bring the knowledge networks from outside. So this, let's say, one of the prerequisites for the lab was to have local champions. It was also important, of course, to have policy reforms to which we would align the work of the lab. And in Moldova, public administration reform and public services reengineering reform seemed like an obvious entry point to which geared towards the work of the lab. And this, of course, was not immediate realization for us. As I told, we started by a very disparate series of experiments just to understand how these things work. So UNDP is not just bringing consultants who deliver for the government, but actually building our capacity inside of UNDP that would be able to replicate those things and continue using this methodology once we learn by doing together with the governmental partners. Another very important thing is, as I told, networks and knowledge networks. And I think what UNDP has been doing outside of Moldova at the regional and global level, the work that we started with different sort of innovation excellence centers outside, was a critical contribution for the work at the country level. I'm sure without this, we wouldn't be able really to advance that much. We really knew whom to call, what to ask. And this is sort of towards people at the headquarters. This is one of the key contributions that you bring to our work at the country level. And this is where we also very much rely on your support. And another key prerequisite before I move forward, working at the lab requires a shift in mentality. This is a completely different thing from the way how we work on projects, where when we design the project, we anticipate how it will end. And we more or less follow the plan that we have at the beginning of the project. Here, we need to be absolutely open. We don't know what initiatives may come up either from the government or from outside of the government. We also don't know how things turn out, because this is not something where it's only UNDP delivers. We deliver it together with the government. And of course, there are different political dynamics in the government. Some initiatives may, at some moment of time, meet sort of a wall, and we cannot continue. We cannot continue with upscaling. It's, of course, a bit of sort of despairing in a way, but we need to be able to handle this and to move to another initiative, which eventually can be brought to the end solution. And so this is what I call a sort of a startup mentality. You need really to be able to handle several initiatives which have very ambiguous ending after all, especially at the beginning. So in a way, currently how we see it, we have two main strands of the lab's work. One is sorry, I will change this. One is about redesign of public services. This is in a way what we see as the core activity of the lab. It's very much integrated into the policy reforms in the country. We are now working with the e-government center and with the state chancellor with the planning of the public service redesign. And by the work that we have done in the previous year, what we achieved is to ensure that this is MiLab who will be working on the methodology for this public services reform. And by this, we will ensure that design thinking will be a sort of a core methodology generally for the national reengineering program in Moldova. And I think this is quite a sort of a cool achievement, because besides having someone coming from I don't know, from Baltic states or from another more advanced in a way country who has public services writing a blueprint for us, we have a methodology from the MiLab, from FutureGov, adapted to Moldovan conditions that has already been rolled out and practiced here, that will be part of our official work together with the different government agencies that will embark on public services reform. But I think one of our key considerations, we don't want to be, in a way, the role of the lab is not to deliver this particular type of reform. The role of the lab is also experiment, sort of shift boundaries, challenge things. And this is why we also keep open the door for the second strand, which is about the future product lines, where we are yet experimenting. We are not sure how we would be able to mainstream this kind of work into what government is doing, but we at the same time consider this as strategic. And this is where we try to accumulate sort of the body of evidence so that we can advance our case when we will be discussing it with the government. And this kind of work is about actually collective intelligence in policy making, how we can involve people in design or validation of different policy options, and at the same time, what are new tools that we can use for the evaluation of policies. Here are a couple of examples. Keep pushing button here on my laptop. Here are a couple of examples of the redesign work on public services. One of those is work with the National Social Insurance Chamber, where we work together with the government center and with that team on redesign of monthly childcare benefits. And what's important, when we worked on the service, we looked both at what happens at the back office, how we can streamline the processes, business processes that public officials are doing, but at the same time, what happens at the front desk, at the front office, as interface between the customers and the servants who are delivering the services. And for instance, at the back office, we managed to cut procedures from 27, if I'm not mistaken, to 8. But at the front desk, we, for instance, discovered obvious things, like they don't have any space for kids, because many young parents who would be coming to work on these papers would need to put somewhere their kids, and there is no space. And this is so obvious, so intuitive, but at the same time, like no one has thought about it, and you cannot really realize it before you start doing the observations on the ground. Another thing is that showed different mentality of the public servant and the customer. If you would ask public servant about what is the main problem, that would say there is a lot of duplication of work between or what happens at the back office. When we ask people what is the main problem for them while preparing all the documents and getting the respective monthly benefits, it was, okay, we don't understand the language in which the government puts the information on the website. So they needed a sort of a physical interaction with the service providers to understand what is actually required, and had to commute several times to understand actually what the papers they need to bring to the government.
I can relate to that.
Sorry?
I can relate to that.
Yeah, everyone from us, I think, can relate to that. And but once implementing this pilot, we understood also we sort of hit first hurdle. Once the redesign and sort of the blueprint for redesign was done, the question was about how we hand over, how those things that we proposed and agreed with beneficiaries are actually taken upon in the government, because people at the agency may say, okay, but our funding was cut, we cannot take it now. We don't have resources to integrate it now. We need further support, and this brought us to the question how we would actually ensure and put on the paper the process that it's clear where the lab is leading and sort of and working with the respective public agency in the service design, and when the handover takes place, and where we are just can provide some distance support. But this is already responsibility of the public agency to continue the work that we started. And here you can see a diagram that we adapted from Nesta, and actually shows that once we are taking the step 5, delivering, implementation, embedding, this is already the role of the public agency to take over and to continue, and MiLab just providing some on-demand support. And this is exactly what we are trying now to agree as we sort of trying to embed the lab inside of the government. Another interesting example is the way how we actually, through a UNDP project, managed to embed something into a broader national policy context. I think some of you remember we had a project dedicated to redesign of community police station.
Yeah.
And where we really tried to work on both social interaction side between the community and police station, but at the same time on how we rearrange the physical space, because what we actually get funding from United States government was to renovate the police community station so it would be attractive to people. But of course, what, for instance, each police officer wanted a personal office. And this is not what they would be able to afford, because they had actually different functions to deliver. They had to do paperwork, they had to interrogate possible eventual offenders, they had to talk to witnesses, they had to talk to witnesses, and they needed to have restrooms. And this, in the limited space that they had, you couldn't combine both, having personal rooms and at the same time functional rooms. And in these discussions, we managed to shift it from their perception of having their own turf, their own office, to the functional rooms that would be also open space, so everyone could see what is going on, and this would also sort of inspire trust from the people towards the police officers. Why I brought this example now is not only because it was such an interesting combination on the space redesign with the social interaction redesign, but also because now this is a part of a bigger project that USAID will be soon be supporting through UNDP for a broader community police reform in Moldova, and there would be several more community police stations following the same approach and redesign as we did at that particular station. There is one more recent examples, and quite challenging one. Again, it's sort of the entrance for the redesign was through a UNDP project that works on a joint work between a registry agency that keeps the records for the home residents and so forth, and the Central Electoral Commission, as we want to ensure that e-voting becomes possible for Moldova. For this, we need e-voting lists and the interoperability around home residents, so there is no double or multiple home residences, and we avoid this kind of irregularities in the electoral process. And this is how we stepped in, and we started working with this register agency on in ensuring, for instance, interoperability between different entry points for the data. We have registro, we have civil state office where different acts on birth, marriage, death are issued. We have also cadastral agency that looks at the real estate. And of course, this implies that there are multiple processes going in parallel. We want to ensure that this is something that is put together and at the same time can be done online. And the progress here, we are so far, we had the research done, we had recommendations provided, but we are still in the sort of a political work around it, because of course there is some often reluctance by the public agencies to enact changes. And so this is a work in progress. And this is what, for instance, how the government to customer services to different clients of the government can be readjusted. We have a good example on how the service provided from the government to the business can be also redesigned. And this is the one related to the honey export certificate. This is a particularly important thing for Moldova. Honey is the only animal product that is allowed to be exported so far to the EU under the Deep and Comprehensive Free Trade Agreement between the EU and Moldova. and because of different phytosanitary things, and Moldova still didn't comply. But this is a good sort of a pilot, because once we manage to resolve this, it can be upscaled once Moldova is ready to export other animal products. And there is, and here is an interesting example. This is where the business service design actually hits political economy of vested interests of different groups of people who want to make the process as much as possible non-transparent and limit the involvement of the exporters to a minimum. And this request came from the Prime Minister's Economic Council to help the Food Safety Agency redesign the process through inclusion of the different honey producers and exporters. And this is where we are working with them on a new stop shop, where that would be open to different, in a simple manner, would allow different exporters benefit from it, and where everything would be in a way transparent. The whole process, they could be following it online, understanding what's going on, and having feedback from government on how things are evolving. At the same time, we want to, in a way, design it together also with the exporters, not only with the government officials.
So Alex, just, I may have missed that. So this is in the making?
Yes, this is in the process that we are doing.
Request.
On the request from the Economic Council that sits with the Prime Minister.
The Economic Council saw the value of the prior experiences, therefore
yes.
It's coming to UNDP to say, all right, help us branch off into this.
Yes.
Very good.
Yes. So in a way, what's very important, the government understands clearly that there is a huge gap between them and society, including because they came to power in some particular circumstances, and they in a way are trying ways to solve, in a way, to bridge this gap. And what's important, they understand that the way how they interact with the citizens around services is one of the important areas where they really can work without going into this into very politically contested issues of democracy and this kind of things. This is something relatively a bit shielded from general political inclusion in a way, but allows in a way to include beneficiaries into the focused service process. And another one is also of particular interest. I will now look more at the sort of what we think could be the future service line. As I told, we don't want the lab to be seen just a delivery agency for the service redesign, because once thing became mainstream, the lab should look beyond that and to see what could be the further challenges and how we can help government be prepared to handle those. And there are two particular things around policies. One is about building evidence for the policy, and another one is about, in a way, about using data for design of the policies. Another one, after the design cycle, after the policy is implemented, how we actually can evaluate it better, and how we can use randomized control trials as ex-ante analysis before the policy is upscaled at the national level. But one of the examples is, I mentioned the perfect storm that we had last year, and there was a strong demand both for us at the country office to have a sort of an analytical framework to understand how we anticipate those things better, how we see different implications that that go, for instance, from drought to social unrest, from remittances to poverty and other things. And this started also in the process why the 2030 agenda was adopted, and all this put us in a very particular situation. We have, of course, a lot here about 2030 agenda is about complexity, integrated nature, and interconnectedness, but how we grasp it, how we capture it at the country level, and what can we do about it. And so started our work on sort of what we call the risk dashboard or early warning system. Yeah, sorry for this. Where we tried to look at different development risks and to understand how they actually propagate through the economy, through the society, our initial iteration had sort of a 50 development risks, where we looked what indicators we have, what we don't, how governance issues interact with economic issues, with social issues, and so forth. In the result, we managed to build a sort of a map with different development risks that are sort of also ranked by areas, but also they are ranked by their impact and their prominence, and how we can also see the connection between them. And what we thought, it's very important that once this thing is developed further, it's very important that the government has this tool. Like these things started happening in Moldova in 2015, in the summer, in autumn, and the first meeting of the National Security Council that tried to bridge and to connect all those issues and approach them in complexity was in the spring of 2016. There is a huge, in a way, a huge gap in terms of things happening and how we react. And this gap needs somehow to be addressed. Besides sort of trying to address complexity, I just want a couple of things more on this. It also allowed us to understand that there were a lot of white spots in terms of data that we can bring to inform the decision making. Those of you who saw the list of indicators for the SDGs, you saw there are a lot of sort of red indicators, where even at the global level, we don't know how we would measure, for instance, how we would measure corruption, how we would measure human rights abuse, what could be the indicators. And this is the thing also that we have come across while looking at our dashboard. And this is how, in a way, our work on understanding how we can bring in user-generated data or big data for evidence-based policy making can help. I will just give one of the example that I think is very elegant and that we will be piloting together with the government, with the National Bureau of Statistics in the coming months. Moldova had a population census in 2013, and due to different financial and political reasons, we still don't have that data published. There are a lot of questions around methodology, how the census was conducted. So even when the data is published, it's not reliable. And we thought, okay, one of the issues is that we cannot for sure know how many population from how much rural population has left rural areas to the cities and abroad. What could be the approach to this? The idea is very simple. We will be using power consumption data in rural areas to spot the households that are abandoned or where the consumption is minimum. That means that many members of the household left. And this would inform, first of all, our understanding how much population has left overall in the rural areas. But at the same time, there are a lot of investment decisions being made by the government and by the development partners when they build infrastructure in rural areas. Do we really need a sewage system or water supply system in a community that is being increasingly abandoned? And where the population would be able to have money actually to maintain those systems? And this is something that you don't need like to come and to build something very complex. This is the data that is already being collected by the power suppliers. You just need to get the data and analyze it. And then, of course, after validating, you can use it at the national scale. So this is just one of the examples where we think our work on data can also bring insights for the decision-making by the government. And another example is randomized control trials that were mentioned. Those are taking increasingly popular in many governments around the world now for the evaluation of development impacts. Just a couple of weeks ago, I attended an annual behavioral exchange at Harvard, where we had several sessions on emerging units, meaning new governmental teams that are placed at the center of the government that help governments to leverage behavioral insights, design thinking, and randomized control trials as the way to evaluate policies to inform the decision making. We now have such a unit in Germany with the Chancellor Angela Merkel. In Canada, there is a Central Innovation Hub. In Australia, there is also a behavioral insights team placed already at the central government. And earlier, those teams appeared in the US, of course, in UK, in Singapore. And as we know, in the EU, there are also several teams that are working with different types of application of behavioral insights. So what we thought in Moldova, were clear candidates where you could actually use behavioral insights and randomized controlled trials to evaluate the impact. One of those is treatment of tuberculosis. Moldova has quite some problems on this, despite the fact that over 10 years, Global Fund for Malaria, HIV, and TB has invested a significant amount of money in the country to fight TB. And our research with the behavioral science team showed that perhaps this is because the way how the treatment is organized. And this is how we decided, instead of directly observed treatment when patients have to commute daily and take the pill in front of the doctor, perhaps we could use a video tool that would allow patients to take pills in front of the cam, record this, and send it to the server. And in this way, we would avoid the hassle of people traveling, the stigma of people seeing that they are leaving somewhere, going, and then coming back. People would be able also to live their normal work life after taking the pills. Okay, we decided we need to evaluate this through randomized controlled trials to be sure that if this works in a particular area, then it could be upscaled at the national level, and this way we could save millions of dollars that are being spent on it. A big advantage of RCTs is that once you're trying to build the data streams for both control group, where there is a usual traditional treatment, and treatment group where you try something new, you need to ensure that in the control treatment group, everything is under control and things are happening as they are written in the protocols, as they're on the paper. What we discovered is actually in Moldova, the recordings about treatment in the directly observed treatment are really a sort of a hoax. They are painted by the doctors. You would come to understanding that like 50–60% of recordings on the treatment are fake.
Sorry, what does that mean? Like recordings of treatment, what does it mean?
That means that, for instance, doctors may give a patient pills for a week ahead, for a month ahead,
yeah,
and they're not actually sure that patients are taking pill every day.
So the status quo is, I'm diagnosed with TB. I have to go physically in front of the doctor or nurse and take it, leave my house, go to the hospital,
yeah,
and take it?
No, there are two periods. The first 4 months you are you have in hospital treatment.
Mm-hmm.
After this, you are on a positive track. You are released, and you have like from 3 to 4 months to continue treatment at home, but coming every day to a clinic to get the pill in front of the doctor.
Every day?
Yes.
Okay.
And what doctors were doing, they were just either taking money from the patients or simply, to make it simpler for them, just gave the pills to the patients. And of course, you were not sure. On the record, the adherence rate to treatment is 90%. In reality, once we started doing RCT, we understood we are not sure. And in this way, we wouldn't be able to show that our approach is better. That's why we had, first of all, to set up properly the process for the clinics that were in control group, to ensure that there is a process that would allow us to document properly, and that would mean sort of a digital stamp by the patient that I'd taken this on this date, the pills from the doctor. And after this, to start measuring. So for us, it was a sort of a discovery in the process. We didn't fully expect this. It set back in time the RCT for us, but at the same time, it showed a huge value of this approach in terms of ensuring the robustness of the process and the value of the data can bring to the policy work. We are now already, the RCT is ongoing, and the first signs that we have after the first 3–4 months are very, very positive. We have still very limited sample, it's growing, but for the limited sample, we see that our treatment is better by several times than the treatment in the standard group. So for instance, if in the standard group, the adherence rate is around 30–40%, in our group it's from 80 to 90. We don't sure that if this effect will persist once the sample is bigger, but this is already a very positive sign for us. No less important, we have agreement from the Ministry of Health and the Global Fund the organization that implements global funding for TB treatment, that it will be upscaled at the national level once the experiment is over, and we show the value of our approach. Another one is a very interesting example, just very briefly on it, because I'm in a way running over the time limits. We often provide grants to NGOs. Now with the innovation policy challenge, we can provide sometimes funding for NGO, for private sector companies. But how often we know that our money makes the difference? We have this project that is funded by the government of Norway on support of innovation in the small and medium-sized enterprises. We first help government to develop innovation strategy for the business, and now we, in a way, one of the tools was public funding for SMEs to innovate, and now we are testing it with the Norway funding to see how it would work. Again, we had this innovation challenge run, and we have a group of companies that has passed the competition. We divided them in a control group and treatment group, and we are evaluating impact of our funding through randomized control trials. So, for instance, we were able to provide up to $8,000 to a company. Company had to match this funding with their own funds, or even give some more funding. In 1 year, we will be seeing results in terms of productivity, in terms of capital turnover between the control group and the treatment group. And in this case, we would be knowing that whether this kind of approach of support to SMEs actually working in Moldova or not. I think the last thing we worked on, trying to crowdsource policy making. By the way, under our post 2015 national consultations, where we engaged with people for them try to see what are the main challenges for Moldova, what are the key drivers, and what are the connections between different triggers and different risk factors. And here, what very prominently came is that the connection between migration and trust in public institution was something that everywhere was acting like in tandem. It really created a sort of a full loop where it showed really how important trust in public institutions is important for really sort of a stopping migration, which is really, really very prominent for Moldova. Moldova, by the way, is...
so this was about out-migration?
Yes,
right? So
out-migration.
The higher the trust, the lower the migration.
Yeah,
as a correlation, you were able to...
And this is not like a minor factor. Moldova is a country in the worst situation in Europe in terms of demography. We have a sort of a developed country aging, but at the same time, we have outward migration that is typical for developing countries. So it's really a huge challenge for the country. Yeah, and just lastly, I think the key strengths for the lab in case of Moldova is, as I mentioned, access to networks of experts, a strategic location close to the center of the government, where we really are able to mainstream our innovation work in different sort of areas of reform and influence it from the center. Having sort of a support from the center, at the same time horizontal vision, we are able to hook to different agencies to work with them. And I think the last one, what we are working, we have a small team, but we are trying to bring people with different skills. Like we have a policy analyst, a designer. We now brought a data person from the banking system. We're also looking now to bring someone who has an understanding of the public sector, who has a public sector experience. Because since we are working with the public sector, even if we are well-read and well-intentioned, we often don't understand certain issues of the way what motivates public servants and how things reconcile in the governments. And we are also now working a lot with at the local level. So for us, it's important to have someone in the team who has an understanding of the local. Yeah, I think I would really stop here.
And sorry, just a practical question. Is the center that you referred to, is it an actual physical center? Or
yes.
Is it within the UNDP?
No. It's both in terms of being sort of politically with the center of the government, but being also physically from the onset. Our team is placed in the government center, which is sort of an agency that works with the state chancellor of the government. State chancellor is on the 5th floor, and the government is on the 6th floor. in the same government building in the central square. So it's for us, it was very important to avoid what sometimes happens to UNDP projects, that there is a sort of a gap in relationship with the main counterpart, and we wanted to solve it also by the being people physically present there, being able to communicate each day there, and being sort of immersed in the work of the government.
First, I'll give you a hand. Thanks, Alex. So just to recap that, for telling that story, MiLab sits within the e-governance office in the State Chancellery.
Yes.
Okay. Good.
But you're not in the lab, you're in UNDP country office.
Sorry?
You're not in the lab, you're in the
No, I'm sort of a
In between.
lead. I dedicate my time to support the lab, but I'm sitting in the country office because I have a big portfolio of issues for each I responsible.
And how many people sit in the lab?
Now we have 4 people. Mm-hmm. But once we, as I mentioned, we are working on this public service redesign program. If we get our going and MiLab, as we plan, is part of it, then we will need to expand the team, and we will be hiring.
And they're all financed by UNDP, or
it's partly funded by UNDP country office, partly funded by the Istanbul hub, which has a funding from the Catalytic Fund for regional experience of facilitating certain of the lab. We have now, starting this year, UN Women funded, who joined the lab. We have some funding from UK Embassy in Moldova, and we have some funding from Moldcell, which is a private mobile telephony company.
It's a very nice story on the partnerships as well.
Yeah, it's not always easy because each of the partner has own interests, but in the way we are trying to anchor what we do to what the government does, so that we.
It's super interesting that UN Women is there, because we are often asked, what do you do with other agencies on the ground? Do they engage substantively, or they just give money?
No, they engaged very substantively. They are very, very now keen on working with us. They see, actually, they, in a way, all the innovation work is going through the MiLab. We are working together with them with redesigning of unified service providers at the local level, which is part of their program, and they have a secondment to the MiLab from their staff, who is also working with us on this. So their involvement is not only financial but also substantial.
I have a million detailed questions, but I want to sit with you, maybe also one-on-one, discussing this very specific proposal of UN Women. I'd rather leave it now open to everyone else if you have questions.
One thing caught my eye, next to that mini observation, the randomized control trial on treatment, there was the other one, randomized control on policy. How do you do that? Because yes, you could do one policy by expert and one policy by evidence, but how do we actually then measure which policy works? That's not as easy as looking at treatment over a few, course of just a few months.
No, okay. Of course, I would admit not all policies can be evaluated through the RCT. But for instance, let's take example with the support for SMEs. The government has a decision on its hand whether to dedicate limited funding to setting up a public fund to support SMEs. Yeah. Should they go with it or not? The way how often it's done, it's written in the strategy. We go ahead, we implement it, and we hope and we try to present it works. What RCT in this case is used as sort of an ex-ante version. Before rolling it at the national scale, let's run something at a limited scale with the limited funding and see whether it works. If it works, okay, let's go ahead and have it at the national scale. If it doesn't work, then we need to think about something else. Iterate to see what different kind of support we would be able to offer to them, so it really makes the difference.
So the expert setting would have been at the national level immediately, roll out big, and the evidence level is let's do a small pilot first.
Yeah, before you're going at the scale, you try to test it at the limited scale and see whether it.
Just for, if you're interested in this approach, there's a really good paper by the UK Behavioral Insights team in policy formulation through RCT. Actually,
learn, test, adapt.
Yeah, exactly. I just tweeted it. It referenced to Alex. If you look at my last tweet, there's a link to that paper, and it's really, really good. And there's a larger conversation at hand. On the one hand, about cash transfers, for example, to address poverty.
Yeah.
And MIT Poverty Lab did a bunch of RCTs across the globe and could speak with authority. And there's one on SDG 9. What helps to drive innovation for economic growth? And there Nesta did a huge study, and they pretty much found out.
And behavioral ST also has a ST on vouchers, so the two types of experience. I think, by the way, an important thing while talking about limitations of RCTs, what is also important is actually how you achieve a scale and the costs of RCT.
Yeah.
Because, for instance, what we discovered with the TB project, that actually costs increase because the data streams, the data collection in the standard setting was not set up as we expected. So we need to invest more to cover for this. Another important thing, it's a bit more difficult to do in the small countries than in big countries. Because in Moldova, it's very difficult to have a sufficient sample, for instance, in the SMEs who are applying for grants. Usually we would like to have, like, I don't know, 809 entries of companies. So in this experiment, we are quite at the edge, actually, of having enough companies being enrolled there. So this is also something to keep in mind. And in countries with bigger populations, with bigger economies, it's much easier to have than in smaller countries like Moldova.
Alex, unfortunately, we have to go to a different meeting in 5 minutes, but on the SME study, when do you expect some sort of results?
I think in January, February 2017, we would have quite convincing set of results, if not final.
Yeah, because it really has the potential of being very, very relevant for the organization as a whole. As you know, every country program document you look at for the last 20 years, that's some sort of business incubation type work, and this is blind faith in providing that, or the cash transfers, of course. So if you were able to show some very interesting finding either way, I think it would speak volume in terms of our ability to measure results. I do wish my colleagues from our development input group would be here, because they're all about results and the IRRF. To my mind, I'm always trying to link this to what is it we do as an organization, how we can show the value in that context. So do you think it's a good thought to sort of the research side of this, if you will, to produce papers, to produce studies that we would? I mean, how does that work in terms of the knowledge management side?
Of course, we already tried to document it via blogs. There was something flexible, but of course, each time there will be a sort of a concluding paper with the results that will describe also methodology, the trial protocol, and what were the results. I think what's, for instance, with the TB experiment, we already sort of a part of a compendium published by the WHO on rollout of video observed treatments around the world. And UNDP is exactly there because we led on an RCT. And there are very few RCTs actually being conducted on BOT. The BOT being tested in different countries, but 2 or 3 only are actually being now evaluated. There is no yet one RCT completed on BOT globally.
I'll join the meeting later with the comms colleagues, because I want to take the advantage of.
I don't know.
Yeah.
Okay. Great.
Maybe you can talk first, KM, and